Hey, we're gonna do ischemic heart disease in two separate little videos. One is to describe the pathology and another to describe the treatment. So again, we've got another picture of someone with their mask on without their gloves looking at an x-ray, which doesn't make any sense. But anyways, ischemic heart disease pathology and treatment. Ischemic heart disease is anytime you have an imbalance between oxygen supply and oxygen demand of the heart. So typically this occurs when you have atherosclerosis, which diminishes blood flow, and increased myocardial demand as during hypertension or physical activity. And the result there is that mismatch between supply and demand produces a low blood flow state. And just so we're clear, when we talk about ischemia is a lack of nutritive flow, and that ischemia results in two things: hypoxia, a lack of adequate amounts of oxygen, and hypercapnia, accumulation of CO2 from the diminished blood that would normally remove that from the tissue. So that mismatch between supply and demand that creates ischemia, just like any muscle in your body, that produces dramatic muscular pain. When that occurs in the heart, it's called angina pectoris. We've talked about this before, angina. A lot of times people refer to that as something like a disease. It's not, it's simply a symptom. So it's described here, chest discomfort. The discomfort is quite significant. Oftentimes that can feel like a crushing chest pain. Sometimes angina will be a pain in between, in your back actually, in between your shoulder blades, and then oftentimes radiating down the left arm or up the left side of the chin, or even in women sometimes can manifest as stiff neck even. So sometimes a bit more than just that crushing chest pain. The supply and demand part of this, just to parse it out a bit more, whenever you have a diminishment in that supply, we normally think of that being the result of atherosclerotic plaque that accumulates in the wall of arteries, narrows the blood flow, and produces a diminishment in the blood supply. That is often the case, but also recognize, since we've talked about heart failure, that can also produce a low oxygen state. Heart failure is when the left ventricle doesn't generate enough pressure to perfuse the tissue. We talked most notably the kidney. That also includes the heart. Has to generate enough pressure to go out those coronary arteries to provide the heart with adequate blood flow. So that could be another supply failure. And then, of course, you can imagine a clot formation. If you don't remember the difference between thrombosis and embolus, refer back to your stroke stuff. And then vascular spasm can occur anywhere throughout the body, and then when it's significant enough in the heart, it can diminish supply. On the demand side, what we mostly think of as increasing myocardial oxygen or demand is physical activity. Any sort of aerobic type of physical activity or activity causes an increase in demand. Certainly a state where you have high hypertension, that increases the workload of the heart, which also increases demand. One thing that's rather unique, it's number one on that list, is an anemic state. We have a lower oxygen carrying capacity of the blood. That's going to result in an increased need for blood flow, since every unit of blood is carrying a smaller amount of oxygen. Epidemiology, very, very common. This is 2017 data. 18 million people in the United States have coronary artery disease. This manifests itself with overt symptoms. In a lot of cases, people don't even know it, and that's why it can be very difficult to manage. The risk factors, I'm sure some of you are familiar with this. A lot of the things that you're going to be dealing with in your write-up are things like hyperlipidemia, hypertension, and then not necessarily diabetes per se, but high blood sugars, which would result in a higher insulin state. So go back and review your hyperinsulinemia, obesity-associated hypertension stuff, as well as smoking. All of those are associated with increased risk for cardiovascular disease. Variety of identifications, but the main manifestations for ischemic heart disease or coronary artery disease or cardiovascular disease, as we mentioned, that chest pain is oftentimes, whether it's a stable angina kind of feeling or it's exertional angina, where the chest pain comes on with increased physical activity, is a lot of times what people refer to or kind of regard as the most common, but also recognize, as we mentioned, heart failure and arrhythmias can produce or are symptoms of ischemic heart disease. Oftentimes, patients can have significant ischemic heart disease and be asymptomatic, and they don't find out that they have heart disease until they have a first big symptom, which can be a heart attack, or in some cases simply sudden death, which is obviously not a desirable way to figure that out. That's why you guys have learned to do cardiac stress testing throughout this semester. It's a great way to determine the level of physical activity that is required to delimit or limit blood flow in someone that has ischemic heart disease. You guys remember when we've done the ECG tracings, these tell us rate, rhythmicity, and perfusion. Of note when you're doing a cardiac stress test is the S to T segment on any laser, especially V5. ST segment changes are indicative of ischemia. Physical exam also looks at some of the other things. Obviously, resting blood pressure would be important. HDL, LDL, total cholesterol, some of the things that you guys are also doing for your practical write-ups. During which, I put a treadmill on there because most often cardiologists use the Bruce protocol, and they're looking at ECG at rest and then during stress. You can do other imaging techniques on a treadmill. This is usually kind of the first identification. The pathology of heart disease is actually fairly straightforward and almost simple. It's a diminishment of the flow to the heart, and it's most often associated with atherosclerotic plaque. And so as we go through the treatment of this, you'll see that the treatment follows that pathology fairly closely, and we'll do that in the next video.